And staying in Nigeria, the country has been battling a rapidly spreading Lassa Fever outbreak. So far, 31 people have died from the disease. Among the dead are healthcare workers. 405 suspected cases have been reported, with 105 being confirmed through laboratory tests. Once more, here's Deji Badmus speaking this time with the Nigerian health minister on the issue.
Lassa fever has been with us for almost 50 years. But then we had a significant upsurge in 2010, 2011. And the worst peak in the history of this country happened in 2012, when we had close to 2,000 people infected. And then quite a number of health workers also died in 2012. And ever since, the graph had been on the decline. And last year was particularly worse than what we've ever seen. But to me, Lassa fever is a symptom of lack or a weak health care infrastructure. When you see it happening, what it tells you as a health minister, as a public advocate, is there is something wrong with the health system architecture.
So, so far, how many states have been affected, and what is your ministry, the Ministry of Health, now doing to contain the situation?
Well, in the past, Lassa fever used to occur only during dry season. Obviously, because there will be no food for the rats in the forest. They move closer to homes, and they're looking for food. They contaminate our food, and when we improperly store food products, they will urinate and defecate on them. Last year, we had about 30 states affected. So far this year, we've recorded 15. The worst state affected this year is Ondo State, followed by Edo. But in terms of mortality, the worst hit is Ebonyi, where 7 of the cases were really linked to one single case of a botched or improperly done euphilectomy. And we suspected that that person was infected. And so the 7 health workers who attended to him during that surgery also got infected.
It's quite surprising the number of medical health workers that are coming down with this fever. What exactly is the problem? Is it that they are not well informed, or is it that they do not have personal protective equipment? What could be responsible for this?
It's not unusual for generals to die at war front. One, it tells you about the severity of the battle. And also, it tells you that even generals are also susceptible. But the question should be, how do we protect ourselves? You need to think Lassa fever. Quite often, we make assumptive diagnosis of malaria. We treat for a few days, and then we switch over to typhoid fever. There's nothing like that. So we need to think Lassa fever. We need to protect ourselves, wear gowns, wear gloves. Especially when we are dealing with body fluids, we must be protected. Cleaners should wear elbow gloves, gloves that will get to this part of the body in order to protect them. And also, we need to look at how do we transport samples. Quite often, relations transport samples. And when they transport samples, they can also be infected. And lastly, we've been using relations as carers. That means they're also potentially liable to be infected.